Happy New Year. So today on my Instagram Live, I thought I would talk about how to get the most out of your consultation. Every day when I do my clinic, I hear stories from women who can't get the treatment that they want. And it's not through want of trying often. Several years ago when I started dedicating my time to menopause and hormonal treatments, people would come to the clinic very confused what they wanted because they didn't know about HRT, they didn't know about the safety of it, they didn't know about the health benefits of it. So they came really for a consultation just to share knowledge. Whereas several years, decade or so moving forwards to now, people are a lot more empowered with knowledge and information, which is really important because as women, we want to be able to have choice. As patients, we want to be part of the consultation. And actually, as a doctor, I really want to involve my patients and I want them to have the knowledge that's right for them so they can make the choices that's right for them. We know that every woman will become menopausal. That means her hormone levels will be low and menopause will last forever. It's not just a phase in our lives. The low hormones will continue to be low and they will stay low until the day we die. And it doesn't always mean we'll have symptoms forever because symptoms can come and go, they can change. Some people have few symptoms, some people have lots of symptoms. But actually, with these low hormone levels, there are health risks because these hormones, estradiol, progesterone and testosterone declines with age, are very important in our bodies. They work biologically active roles in our cells, in our bodies, throughout our organs as well. So we know there are health risks as we become menopausal. So what is happening out there is really the majority of women will benefit from taking hormones. We know it has more benefits than risks. Even the older type synthetic hormone have more benefits than risks, but the natural hormones have a lot of benefits. They can improve symptoms if you get the dose and type right, but they can also improve future health as well, which is really important when we're thinking about reducing risk of diseases as we become older. So the guidelines that we have nationally, internationally, so globally, are all very clear the benefits of hormones. But actually what's happening globally is it's only the minority of women are able to access HRT. Many years ago when the WHI, the Women's Health Initiative study came out, people weren't wanting hormones and doctors weren't wanting to prescribe it because of these misinformed risks that were portrayed in the media and in the medical press. But that was 20 years ago. Moving forward, we know there are benefits. So women now want to have hormones and doctors are more willing often to prescribe. But, and this is a massive but, still, only the minority, so globally around 5% of menopausal women are taking hormones. So it's not because women don't want it often, it's because women haven't been given the right knowledge, information, but also because even when they've decided, they're met with barriers. The clinic that I run is very busy. It's based in England, in Stratford-upon-Avon, as many of you know. We do Zoom consultations as well. But women come because they can't get listened to in the NHS. They come to us to become just part of a conversation, to be listened to be believed, to be understood, and then be able to receive the treatment that they want. And it's really upsetting actually, the stories that we hear in the clinic. And these are women from all over the UK. They're women who are from all socioeconomic classes. And they come because they're struggling. We see a lot of women who just come once or twice to our clinic. And thankfully, once they're on the right dose and type of hormones, their NHS GPs often take over their care. So we work very closely with NHS GPs. And there are many reasons why people are unable to get treatment. And often it's because of the poor education that NHS healthcare practitioners have received. Many of us have not received formal menopause education, and the education we have has often been wrong or incorrect or not based on current evidence. And so there's a lot of confusion in medical healthcare communities But what I'm hearing more and more, and certainly I hear a lot through my Instagram and social media, is that women are just being told no without any reason. They're just being told you can't have HRT. Now, I can't think of any other treatment in medicine where people are refused in the same way. You know, if people go and ask for antidepressants, if they go and ask for painkillers, then usually they'll be able to have them. Sleeping tablets, addictive medication, often you can't get it as easily, which is a good thing. You know, as a doctor, we have to constantly weigh up, is it the right treatment for the patient? Is it going to give them benefit? Are there more benefits than risks? But it's awful, actually, the stories that I hear. So I wanted to spend a bit of time thinking about how to get the most out of your consultation. And I do spend a lot of time thinking how we can improve this. And as you know, we have a conference, we've got a conference actually coming up in March for healthcare practitioners, but we have an education programme called Confidence in Menopause, which has had over 33,000 downloads from people globally. So I'm very committed to improving education. We've got an education team that I fund within the clinic who have got some really great plans this year now, which is good. But in the meantime, what do you do if you go to your doctor or nurse or pharmacist who just says, no, sorry, you can't have HRT, or you're told that you're too old, you're too young, you can't be perimenopausal, you won't benefit, or you have to have antidepressants, or you just have to suffer? What do you do then? I think the most important thing is thinking about before even going to that first consultation. And I do have a lot of experience thinking about this because of the stories that I hear, but also firsthand because I can't get my HRT from my NHS GP. I might be able to now, but to be honest, I've given up trying because it's so difficult. Even just getting my repeat prescription, I had to choose the doctor who was on call. Sometimes I would get it, sometimes I wouldn't. It shouldn't be such a battle. So what we need to do, when I say we, I mean us as patients, we need to be really ready for either a good or a bad consultation. And increasingly, people are having phenomenally good consultations. So we don't want to be turning up really aggressive and cross because actually we might have a really positive experience. So what I always think is to try and help your doctor. Like, it's really hard. If we're talking about NHS GPs, they have 10 minutes to determine what's going on, to try and work out what the best treatment is, make a diagnosis, safety net, make sure there's nothing else going on that's more serious, that needs investigations or tests. Sometimes they might be running late, they might have had a really difficult day, they might be on call. There's all sorts of things, and I know that from first-hand experience how hard it is. So you want to make your healthcare practitioner's experience of your consultation as good as it is going to be for you. So knowledge is power. So having as much information to hand is really important. So think about downloading our free Balance app. Look on our website, balance-menopause.com. Listen to some of my podcasts where I'm talking with other experts and have the information that's pertinent to you. So if you're young and you're under 40 and you think you might have premature ovarian insufficiency, POI, get lots of information about that. If you're young and you think you might have PMS, PMDD, premenstrual syndrome, premenstrual dysphoric disorder, and you think you might benefit from hormones, listen to some podcasts, watch some YouTubes, read some information about that as well. So then you're knowledgeable. You can also go on to PubMed, you can look at some actual literature, scientific literature as well. That's not a bad thing. Sometimes it can be confusing, but there's still a lot of references in the work that I write, so you can always look at that as well. You can look at the guidelines and just look at the summary of the guidelines and then work out what you want. Now, I'm talking here as if people want to take hormones. There will be some people that won't want hormones, and that's absolutely fine. But if you do want HRT or you do want testosterone, then make sure that is the thing that you start really talking about at the beginning of the consultation. Because what you don't want as a doctor to have someone talking for 9 minutes all about their symptoms and then right at the end to ask about the treatment. Because if the doctor isn't ready or maybe doesn't know how to prescribe, You don't want to wait till the end of the consultation to hear that. So if it's HRT you want, if it's testosterone you want, if it's vaginal hormones that you want, then think about the reasons for having them right from the start. So if I think back 8 years ago when I was having awful, dreadful perimenopausal symptoms, it was quite hard actually to string a sentence together. It was quite hard to think about what I really wanted. It was quite hard to remember things. I was very emotionally labile, quite tearful, quite short-tempered as well. So actually writing things down I think is really useful. So having a list of things, but also doing a symptom questionnaire, which you can get from Balance. You can download the health report. So actually have the symptom questionnaire and go through the symptoms. So they're either mild, moderate, severe, or you don't have them at all. There's 21 symptoms on the questionnaire. We're actually introducing a new questionnaire this month which has a lot more symptoms, so I'll let you know about that when that's available live. And then mark them down, print it off, and then that's your symptoms. Some people might not be experiencing many symptoms, but they might want to consider HRT for the health benefits for their bones, heart, brain, and so forth. So think about the reasons that you want to take HRT, testosterone, vaginal hormones, and have that in the forefront of your mind for your consultation, and even write it down if you think you might forget. So when you go to your consultation, I would say, I am here to talk about my hormonal changes, and I would like to talk to you about treatment. So the first two sentences, the doctor or nurse or pharmacist knows exactly what you're trying to get out of that consultation. And then hopefully you'll see quite quickly which way it will go, whether it's going to be a very positive consultation, in which case you're downhill all the way, or if you're met with barriers, that's the difficult part, isn't it? So then I would say, look, I'm trying to help you by showing you my symptoms. I've done these in advance. Also, I'd like to tell you that I've read a lot of information, and I know for me the benefits of taking hormones will outweigh any risks, and therefore I would like to try them for the next 3 months. And then you're setting a scene as well that, you just want to try something. As a doctor, I do not know how many of symptoms are related to hormones or not. What I want to do as a doctor always is to do the best for my patients. I want to try and understand what their symptoms are, and I might ask more detailed questions. So for example, if someone had palpitations, I would be thinking, could any of this be related to a heart condition? So then I might ask very specific questions to try and safety net. So don't think the doctor's prying too much or doesn't believe you. It's probably because they're trying to make sure there's not another condition or potential condition in which they might need other tests. For example, if someone had headaches, they might want to ask more detailed questions about those. So let the doctor ask a few more questions about your symptoms. That's absolutely fine, because we're constantly trying to decide when we've got a patient in front of us, could there be more than one thing going on? So for example, if someone had joint pain, could they have arthritis as well as having joint pain related to their hormonal changes? And some people will have both, and they might need to have an x-ray, they might need to have other tests. So that's one thing to think about, that if they ask you more questions, that's quite common actually. And then I would then say, see what they say about blood tests, because I know a few of you have been asking about blood tests. Do I need to have a blood test before going to the consultation? I tend to prefer to see people for their first consultation when they haven't had blood tests, because there are reasons why I might do a blood test, and one of them might be to try and make sure there's nothing else going on. So if someone, for example, was feeling more tired, more lethargic, very common symptoms of perimenopause and menopause, I might want to do their iron level, their ferritin level, to make sure they haven't got low iron. I might want to do their thyroid test to make sure they haven't got an underactive thyroid gland. So there are other reasons why we might do blood tests. If I think they're low in testosterone, I often do a testosterone blood test with the SHBG, sex hormone binding globulin, to see if their testosterone and their free androgen index is low, because it's just a useful guide. If they're young, I might want to do their estradiol level as well, just to see, again, it's a useful guide. But if someone's had blood tests already, they might not be the ones that I want, so then you might still need to go and have another blood test once what test they're wanting you to have. If people are young, we might refer them for a DEXA scan, a bone density scan. So there might be other tests that are needed as well. Quite often I'll do blood pressure, but I'm not concerned about blood pressure. It wouldn't stop me from giving HRT, but it's just part of a healthy, sort of a health screen consultation, because I want my patients to be really healthy. So we often do blood pressure, not because we're worried about whether we can give HRT or not, because the natural body identical hormones, the estrogen through the skin, the natural progesterone, the natural testosterone through the skin, doesn't increase blood pressure and often lowers blood pressure. So if someone's got raised blood pressure, we can still give HRT. But we do the blood pressure check because it's an easy, quick screening tech, really, just to reassure you. So then if the doctor is then still saying, no, you need to try antidepressants, or you need to have painkillers, or I don't think it's related to your hormones, then I think it is worth asking a few questions and saying, for example, why do you think it's not related to my hormones? And why are you so resistant to me giving me hormones? Often in medicine, we do a therapeutic trial. So we give people a treatment for a short period of time to see whether it improves symptoms or not. And for some reason with hormones, people are more reserved doing this. But I would say to the doctor, look, I'm keen to try it for a few months and then I'll come back and let you know, or a few weeks. It can often take, though, 2 or 3 months to get the maximum out of hormones. So you don't want to have a review too quickly because you might not have improved enough. But I would say, look, I would like to try it. There might be some risks, but I know there are lots of benefits for my symptoms and my future health. And actually, the risks have been associated with the older synthetic types of hormones, which I would like to have the natural hormones, the body identical hormones. The other thing that quite a few people do is print off the Easy HRT prescribing guide, which if you can just Google it, I'll put it on my story. And it's called Easy HRT Prescribing Guide. And that's got some of the common preparations that we prescribe. So the patches, the gels, the progesterone, the testosterone types as well, with the different doses. There's a lot of evidence on that as well. So people might find that quite useful just to show to the doctor, and quite a few people then leave it at their doctors and then they can use it as a guide for other patients as well. If the doctor's still saying no, then I think it's reasonable to say, could you let me know the reasons why you're refusing? And if there is some evidence where you think there are more risks than benefits, please could you share that with me? And I think it's really difficult actually, because no one wants to fall out with their doctor, no one wants confrontational experience, but actually what we do want to have is a really positive relationship with our healthcare practitioner. In medicine, we have some guidelines called shared decision-making guidelines, which are written by NICE. You can Google them and look at them. And I think this is really important for these sort of awkward consultations. So as well as saying, look, I've read the NICE menopause guidance, I would actually say, look, shared decision-making guidelines by NICE are really important in this consultation, and I want to be part of that decision-making process. I've got a lot of knowledge about hormones, and I would like to try them. Even if you think there are risks, I am prepared to undertake any of those risks to have the potential benefits for hormones. I don't feel that as a doctor it's my duty to refuse an evidence-based treatment, and I'm not really sure why other doctors sometimes think that is the right thing to do. You'll know quite quickly whether you're going to get somewhere or not with that doctor or nurse or pharmacist. If you really find the shutters have come down and you're finding it hard to engage in a consultation, then I think what you could do or should do is say, is there someone else I could talk to? Is there another doctor who perhaps has got more experience and knowledge, or who will be able to prescribe me the treatment that I want? And hopefully there will be someone in your surgery that can do that. I know a lot of people are referred to different menopause clinics. They're often in gynecology departments, and I do feel strongly that it's not just gynecologists that should manage menopause and hormonal changes, because they work throughout the body. So it is important to find someone who's not just knowledgeable but has a lot of clinical experience. You know, we have a huge amount of clinical experience in our clinic, because we see thousands of women, we audit data, we're writing up our data, and we learn all the time from patients. We learn from the stories that they tell us, we learn from the symptom improvements, we learn about the doses, we learn about blood tests. We have a massive clinical experience, largest than anyone else in the world actually, and this is really important. Some people say that they are specialists and they might only see a few people a week, and they don't share the knowledge, they don't share the records, they don't do audits the same way. So it is worth, if you're being referred to somebody, find out a bit more about them, because what you don't want to do, and I hear it a lot, is that women are waiting a year to see somebody, and then they go to the hospital, they see a gynaecologist who's got no experience or very little experience in menopause. And what a waste of a year. So find out who you've been referred to. If you decide to go to a private clinic, then do some research, find out about these people. It's easier now, isn't it, to Google people and find out. Find out about their experience as well, their clinical experience and their knowledge. You can go to PubMed and put in their surname and see if they've got any academic publications, because it's not just having clinical knowledge and experience, it's actually having scientific papers as well. I've quite well published, I've written and co-authored quite a few articles and papers, and I also review other people's articles as well for different scientific journals. It's important that people are kept up to date with knowledge, because there's some people who have been very prolific in their writing and their scientific knowledge, but it's like 20 years ago and things have changed and moved on. So you want to work with, or you want to see somebody who's current, who worked with other people in the UK and globally, or in your country as well. So just do a bit of work thinking about it. And then if you are going to see someone privately, make sure that they work closely with the NHS. You know, make sure that they do really comprehensive letters, for example. In our clinic, we write very, very detailed letters, and with the patient's permission, a copy goes to the GP. And so then the GP will have those records, have those notes, and often, increasingly, we hear it all the time, which is so rewarding, that people come and they say, oh, my doctor's actually prescribing the hormones because they can see how much better I am. They're confident, the dose, the type, everything else as well, because they've come to your clinic. So they're taking over the care. And then sometimes they won't prescribe testosterone, but they'll prescribe the other hormones. And then people come to our clinic just for testosterone. So just do a bit of homework, working out where you're going to get the hormones from. It's horrible to hear the suffering that's going on with women, the suffering because they are being refused treatment. There's nothing else, like I say, in medicine, where people are refused a treatment that has not only benefits to help people feel better, but also benefits for future health as well. So if you are struggling, just make sure that you get help. Like, it's a new year, it's a new you. We need to keep positive, we need to keep healthy, we need to reduce risk of diseases as well. So we need to think about keeping as healthy as possible. And if that means taking hormones, then that's not a bad thing to do. So we should be thinking, how are we going to access it without waiting for too long? Talk to other people that you might know, ask them about the experiences that they have. A lot of people are sharing their comments and experiences on Facebook and social media. Just be careful with that, because obviously you don't know who these people are. One person's good experience might be another person's bad experience, or vice versa. So it is always worth trying to talk to people. Phone up the clinics, get some feel for how the people are, ask them about the patient numbers, ask them about how closely they work with the NHS as well. Increasingly, people are being offered contraception instead of natural hormones, especially if they're perimenopausal. These are synthetic hormones. They have risks associated with them. They're only small risks, but they have risk of clot, heart disease, breast cancer, for example. So in my mind, you want to really have the natural body identical hormones unless there's a reason, like a medical reason, to have contraception instead. So ask them, why are you giving me a contraception when I want natural hormones, for example? if someone's on testosterone, then it's usually worth having regular blood tests, so ask about having blood tests going forwards. Some of you might have seen the paper that we've had published on estradiol dosing as well, and some wee milk people do need higher doses to have the right absorption through the skin. So if you're on the sort of maximum licensed dose but you're still having symptoms, ask if you can have your estradiol blood test done to look at absorption to see if you need a higher dose. And if you refuse that, again, ask for the evidence behind it. Some of the guidelines that have been written are not based on evidence, they're more of a consensus opinion. But guidelines are to guide us as clinicians. Everyone is individual. In medicine, it's a science as well as an art. The science is the knowledge and the scientific literature and the academia. And the art is individualising it for each patient and each person. So we need to combine the science and the art when we're thinking about hormones to optimise the hormones, to optimise patients' experience, but also to optimise their future health as well. And so I feel so strongly as an individual we should be listened to, we should be believed, we should be understood, and we should receive the treatment that we want. And if that is hormones, then we deserve to find somebody who can give us what we want. And sometimes it might mean seeing 2 or 3 different people before we really get understood and get the right treatment. But whatever you do, don't give up, because there are always people around. There are lots of resources. I've got a huge amount of resources that we've written, that we've developed. There's a lot more going on this year. We've got some great work going on to really enable people to get the information that they want so that they can be empowered with knowledge to make the right choices for them. So the important thing is to be your own advocate, look after yourself. If it's a treatment that you want to try, then try not to give up, try and be positive, think about the options, and have someone with you. Have someone with you who can advocate for you as well, because that often can be really, really useful. So I hope that's given you a bit of inner strength, some positivity to really think about how you're going to set 2025 as being a very healthy and symptom-free year, because the healthier we are, obviously the happier we are, but also the less diseases we're going to have, the more we'll be able to help and support other people if we're healthy as well. So I hope that's been helpful. Give me some in the comments, give me some suggestions for future Instagram lives. I will keep doing them on a Sunday if people want them and enjoy them and think they're useful. So Happy New Year again to you all, and enjoy the rest of your Sunday. Thank you.